Sundarbans is an archipelago of several hundred islands spread over India and Bangladesh. This delta is abode of largest mangrove forest, now endangered due to global warming, which has resulted in frequent and severe floods and cyclones. The cyclone Aila in 2009 has brought devastation to the biosphere and in the lives of people of the area.
Climate change in Sundarban is experiencing the same fate due to the global warming, change in rainfall pattern and also the sea level rise. The agricultural productivity and fish productivity is decreasing due to the salination of soil and water. As a result, the social and economic vulnerability are increasing.
Wrecked embankments and destroyed farmlands by saline water have stressed the livelihoods of the inhabitants of Sundarbans. Around 4.5 million people, mostly the farmers and fishermen who depend on nature, are at stake today.
We need to assess that vulnerability and plan likewise at the local level. We need to act wisely and appropriately with the adaptation options guided with innovative measures. Change of mindset is also necessary to accept new techniques to combat the situation.
The women population lack specific job skills, which eventually bring children into work. Young children, especially adolescent girls, are trafficked to different parts of India. In order to reduce vulnerability to environment-induced health hazards amongst women and children, Save the Children has launched a project in 2012. The project covered selected area of Pathor Pratima block in South 24 Parganas district in India. The initiative started with forming community-based task force groups and children groups and orienting them on environmental health issues.
এই সংস্থার পক্ষ থেকে যে সমস্ত কাজ আমাদের এই বুথে আসছে বা এই অঞ্চলে আসছে, আমরা এই ট্রান্সপোর্ট কমিটি তা বসে আলোচনা সাপেক্ষে সমস্ত কাজগুলো করেছি।
The baseline study conducted by National Institute of Cholera and Enteric Diseases observed that
more than 60% of women were found to have anemia in this particular study. 25% of them were actually in iron deficiency state. We revealed that 13% undernutrition in children who were 5 years of age or below. It's serious public health concern that women are suffering. When we talked with women, we realized that about 50% of them reported open air defecation. Again, 40% of them said that they did not wash their hand with soap after ablution following defecation. All these require behavioral intervention because hand wash and hand hygiene practice, water management practice and the defecation practices all are intimately linked with the health related problems that we have unearthed.
Sundarbans possess a grave challenge in addressing the issue of safe disposal of human waste. Due to inundation, the common toilets are submerged, rendering them unusable. This causes contamination of water. In view of these factors, household-level EcoSan toilet model has been adopted, which is designed to protect the waste from inundation and is usable even during the monsoons. Families have also been oriented to use a low-cost waste disposal system as part of environmental protection. In disaster-prone areas, constant water quality monitoring assumes serious significance as sources are easily susceptible to contamination. Children have been oriented on easy techniques of water quality monitoring by using readily available kits. This has made them more conscious about the water safety issues. The groundwater in the coastal area of Sundarbans is saline due to the incursion of seawater in soil and unregulated lifting of groundwater for domestic and agricultural use. A surface water purification unit was installed in a local school as a model to reduce excessive dependence on groundwater reserves, which treats the local pond water to safe potable water. The farmers depend on monsoonal rain. Eco-friendly, climate-smart farming practice has been promoted, which involves marginal farmers having small amount of land. In this model, a pond is dug for rainwater harvesting and also to support duck rearing and fish farming apart from irrigation. The excavated soil is used to elevate the plot and grow multiple crops, vegetables and fruits.
আমরা প্রথমে এই জমির উপরে ধান চাষ করতাম, এখন এর উপরে সবজি চাষ করে তার চেয়ে যা ইনকাম করতাম তার চেয়ে দ্বিগুণ ইনকাম আমরা করতে পারছি।
Mangrove maintains the ecosystem on the coastline of Sundarbans. It saves lives and properties during cyclones and also protects the delta from erosion. Increased water salinity and tidal action along with human intervention have destroyed the mangroves.
আমরা বলছি যে গাছ কাটলে তো আরো বিপদ হতে পারে, বিপর্যয় আরো হতে পারে, তা তোমাদেরও ক্ষতি হবে, পরিবেশেরও ক্ষতি হবে, আমাদের সবার ক্ষতি হবে।
Local women have been involved to demonstrate the integrated approach of raising saplings and planting them.
পরবর্তীকালে যদি আমাদের কেউ ডাকে যে আমরা গাছ লাগানো শিখে গেছি, কেউ যদি আমাদের ডাকে আমরা যাব তাদের কাজ করতে, পরে সেইখানে কাজ করেও আমরা কিছু ইনকাম করতে পারবো, টাকা পয়সা পাবো, সেই দিয়েও বাচ্চা কাচ্চারা বই খাতা আরও কিনতে পারবো, খাবার কিনতে পারবো।
As a unique step, temporary bamboo guard walls were erected on the riverbed in such order that facilitate collection of silt and protect the embankments.
The threats of the climate change is increasing. There is a need of the government, the civil society organization, as well as maybe the corporates. They need to actually work together, because this is a problem which is actually not an individual's problem or not a problem of a particular community. It's impacting the global scenario, and Sundarban is one area which is getting impacted most.
The unique geoclimatic condition of the area calls for an action plan which is contextual. This can only be achieved with the empowerment and participation of the local people.